Good evening. I'm Dr. Patricia Kelly Marsh, CEO and co-founder of AskMeYourMD, where we're giving you direct physician access on our web-based telechat platform. I want to invite you to meet our team led by myself and Dr. Sirit Mission. And I'm happy to say that we've led our team to becoming a diverse partner with CVS Health, Clinical Trial Services Division. The rest of our team pertains of 12 PRN physicians, our legal team, and our financial team. And we've been a part of some illustrious incubators and accelerators here in Atlanta. So the healthcare industry right now is very complicated. Even one of my previous presenters, co-presenters, spoke about it, but physicians are drowning in paperwork. And I'm sure you can even have your own testimony about the difficulty in contacting your doctor directly, which leads to confusion, long wait times. And this is all in the context of increasing medical costs. And for some patients, this means that they're having very poor health outcomes. And for our hospitals, that means that they're being hit with heavy fees. 1/3 of hospitals' revenue comes from ratings and avoiding these fees of complications that patients have. And so that's why AskMeYourMD exists. We provide physicians a way to reconnect with patients directly. We give the patients that direct connection to reestablish the conversation and trust. And then we allow hospitals to mitigate those fees and increase their ratings and revenue. Our target market are the 1-star rated Medicare hospitals, as well as enterprises, which add as an added value benefit for their employees or their members. And on the consumer side, we've seen a high uptake from middle-aged moms. The combined value of our serviceable obtainable market is a little over $1 billion. And the value of the telemedicine industry has one of the fastest CAGRs in the world. We stand out from our competitors because we are both on the outpatient, meaning outside of the hospital, and the inpatient, meaning inside of the hospital, with a mission to educate, advocate, and navigate you. So when you come on our telechat platform, you're able to get those answers to your questions directly. We call and make appointments for you because we have that time and we don't have the extensive paperwork of our colleagues. And we offer all specialists as opposed to some of our other competitors. We're web-based right now, so you can access us on AskMeYourMD.com, and we are conveniently available 24/7. So we generate revenue in many different ways. We contract with hospitals, as I stated, and the hospital pay us, and their patients receive our services at no cost. So there's already an increase in ratings and patient satisfaction in that. They are also able to receive incentive payments from Medicare and other insurers. And so hospitals not only, like I said, decrease those fees, but they're getting the benefit of increasing those ratings. We do direct billing of our encounters with the patients we service. And for enterprises, again, that added value benefit at a monthly rate. On the consumer side, they could subscribe to us. We have lowered our fees. So the new fees, $50 a month for adults and $35 a month for students. And we have a fee per service, which is also at a lowered rate of $35 per consultation.
30 seconds.
And then there are some direct billings on that side as well. We've contracted with CVS and are currently onboarding as a supplier. We will follow up with our hospital pilots in the Adventist Health System and follow back up with Microsoft. We have 2 local businesses here with a projected revenue of this year at $1.6 million. Last year, we were able to invoice over 12,000 without any formal marketing, publish reviews, and present to 6 hospitals, 10 businesses, and secure 3 contracts with servicing over 160 patients.
All right, time's up.
Thank you.
Okay, Dr. Patricia, congratulations.
Thank you.
Wait, before we start that, let me set the timer for through. All right, go ahead.
Okay, so my quick question is, can you explain you projected $1.8 million revenue. What is your revenue for January looks like?
The January revenue is looking like $3K. This is the very beginnings of onboarding. So that estimation was at the conclusion of onboarding those 2 hospitals, Microsoft, and being a supplier for CVS.
Okay, seems from 3K per month to 1.8 million per year. That's pretty far.
Mm-hmm.
How? What the probability of achieving 1.8 million? Why?
So 1.63, even though that's not far from 1.8, but I do want to state that we anticipate having that scaled growth once we publish our findings on the value of our service and increasing the revenue for hospitals.
Yeah, I mean, you kept mentioning Microsoft. So what's the deal with Microsoft look like?
So Microsoft is in meetings with us to service their employees as an added value benefit. So this would be a telemedicine service that would basically improve their telemedicine services on the East Coast, and they are thinking in Europe. Yeah.
So do they pay per employee?
Yes, it is a volume-based monthly recurrent payment.
And what do the 1-star hospitals pay you to improve their ratings?
So we have a pilot pricing beginning at 20K per month, and then the full pricing can go as high as, again, it's volume-based, but these hospitals can go as high as 150K per month.
Yeah.
Yeah, for some of the bigger hospitals. Excuse me.
Congratulations on all you've accomplished so far. How many years ago did you start this enterprise?
12 months ago, November 2021.
Great. The question I have
30 seconds.
is how you compare with other
Excuse me.
companies.
How we compare with other companies?
Telemedicine companies, yes.
Right. So it's very different, our offering. We, number one, asynchronous appointments, meaning this is an open forum for our patients. When they have the time, they come to approach us physicians. That direct physician access with other platforms is very rare. It's becoming now more commonplace. But yeah, that's a very higher, kind of white glove service benefit. And then third,